Just quickly introduce Luis, Dr. Luis Kuhn, IEEE Fellow, past president of Society and Societal Implication Tech. So this is the right topic, right? For you, I'm sure in your society you must have done it. A lot of those. Next slide. Okay. All right. So very brief. Again, I'll spare time for him to talk through his talk. So he's a fellow, IEEE as a life fellow IMBE, and IUPSM. Here 2025-26, IEEE past president. He was the president in 2004. Distinguished emeritus professor of national security. He work bridges biomedical engineering, healthcare, public health, IT, and national security. The founding editor-chief, Springer Journal of Health and Technology. He has had many key roles in IEEE USA, including chairing multiple high-impact working groups, spent 14 years in IBM, served as the director of medical system Sinai, helped set US telehealth policy, including landmark legislation signed by President Clinton in 1997. He has distinguished positions at CDC, Paola University, Argentina, UDLR in Uruguay, right? Uruguay, I said, and several institutions across Latin America. In 2024, he co-organized major IEEE STEM workshop. I know we have been talking about it, right? The ISTEM conference in Princeton. So over 40 years, he has been a volunteer, distinguished lecturer, and visitor delivering for 600 talks. Amazing, huh? All right, with that, Luis, let's start. Congratulate Luis and welcome Luis as well. Thanks.
Thank you. Oh, yeah. All right, all my talks generally tend to be very high level. I tend to connect things that a lot of people don't connect. Society tends to work on silos, and we don't realize many times the consequences. For example, we're dealing with economic, environmental, geopolitical, societal, and technological. We cannot deal with just one without seeing what's happening with all the others. From my perspective, and with all respect to the last presenter, to me the number one issue is not money, it's education. I could afford to give a free PC to every citizen in the world, but if you're not educated, you cannot use it. I can give a free phone if you do not know how to use it. Okay. And by the way, there is a new challenge, which is a different type of digital divide, which is each of us that is sitting here, according to the color of our hair or not having hair, we probably like more certain technology than others. My daughter likes to text. I hate text. I like email and WhatsApp. And probably the generation that is born today will not like texting. So my point is, technology is moving so fast that we have to have redundant systems in order to cover the world. So life expectancy has changed substantially, and yet, as I mentioned in one of my comments, currently in Nigeria is 54 years of age, 72 in India, 70 in the States, 85 in many of the developed countries. But you can see the big difference. And basically what happens is every day you add all the people that are born, subtract those that die, you have a net increase of 4 million people. These people need water, food, and energy to survive. So a lot of the conflicts are going to be dealing with that. And that's the way I see the future. That's how I approach national security. Now, by the end of this century, those green spots are going to be mega cities. They're all going to be places with more than 35 million people, not the countries, the cities. So look at the situation and look at the dates. This is September 19th. This is within a week of today, the Himalayas are melting. So what that happens is the 1.9 billion people depend on the water that used to come from the melting of those glaciers. And of course, you cannot listen to the discourses of the United Nations, forget politics. Look at the data, look at the information, and then make your own assessment. But the fact is, where will these people get their water from? And if they don't want the water, they're gonna migrate, period. This happened also this month in Switzerland. More than 6 meters of snow is gone. So they're not gonna have water either. And so this thing gets repeated and repeated. Currently, there are 123 million people that have been forced to migrate. The reasons are very different. It could be all types of climate change issues, like floods, winds, destruction, discrimination. Religious ethnicities, or color, skin.
Have to be there for a minute.
In addition to that, you have the wars. All these things cause people to move. The reasons can be very different. There in red, you have the situation in Pakistan. Suddenly, from one day to the other, 600,000 Afghans come because of the Taliban. On the other hand, in Venezuela, almost 8 million have to escape because they are afraid of getting killed because of the regimes and so on. These are refugees from Syria, Sudan, Ukraine, and Afghanistan. You can see very large numbers, and actually, this is an example. The ones from Syria, they are spread all over the place in many, many other countries. And what happens is when they leave, they might not take things with them. Now, these numbers on this chart came from this document from the World Economic Forum. The last two countries that you see there are Bangladesh and Pakistan. And look at the size of the populations approximately. And next to them, you can see that the internet users, according to the World Economic Forum, was only 12.9%. According, in Pakistan, 17.1%. So what about the rest? So I developed this chart, and those 20 countries that you saw, not countries, cities that you saw in green, and it shows you all those that are in green, 12 of them are in Africa. Now, if you look by the current numbers, the discussion has been India and China. But Africa is growing 5 times faster than anywhere else. Of course, when I told you the other numbers, they don't reach a very high age. So probably they're not gonna have chronic conditions because they don't even have a chance to develop that. They have other problems. But the infrastructures that are poor. So in this case of Nigeria, of 88.3 million, if we look at the numbers of 2019, only 58% have access to internet. If we go to Kinshasa and Congo, well, 83.5 million, 91% have no access. And if you go down the list to Mogadishu, 98% don't have access. So when you put all these numbers together, again, don't listen to the politicians. Look at the numbers, and you drive your own conclusion. And by the way, These are numbers from the United States. The Agency for Health Research and Quality, July 27, 2021, showed this document that shows basically, if you spread it, the very dark colors show like 100% internet access. But as you get lighter and lighter, and you will end up seeing in the report that from 22 to 62% of the people in those areas do not have access to internet. This is the United States. And again, I could say we could afford to give a computer to everyone and a phone. But then you start wondering, where do they get information from? And this is an incredible time that we're living about misinformation, disinformation, false information. Who do you trust? And you have an incredible polarization of the masses between what some people call the left, or the social side, and the right, or the capitalist side. It doesn't matter how you call them, but there is a stigma here. So it's very difficult to work together about anything. Okay, so of course, the more we advance in science and technology, the longer we live, which that part is great, but more and more people, as we live longer, we have more chronic conditions that start manifesting. And you become extremely expensive. The last year of your life, unless you die from an accident, is going to be the most expensive one. So no country, including the United States, can afford it. More unsustainable because the numbers keep growing. Every time we have more people over 65, over 85, and so on. So the healthcare system here is a disaster. And so what I've been talking for many years now is transforming. When Obama talked about reforming was necessary, but not sufficient. Transforming means that imagine going to the doctor when you're well and tell them to keep you well. So that means your focus now is not the disease, but your wellness through prevention. And this happens as engineers. Prevention is always better than responding to a massive of networks and so on. So now the importance of multidisciplinary and interdisciplinary is a huge issue, and I'll try to come permits at the end that there are technological and accidental hazards. You remember Fukushima, and the moment that you have an explosion of a nuclear plant, you're going to have people migrating. You can not only not eat the food, but people have to move from there. You have terrorist hazards. You have dumpings that we did in the 70s and earlier with radioactive materials. We have this dome in the Pacific that already shows some cracks. There are radiological materials inside, but as the waters of the ocean rise, this radiation can escape into the ocean, and then we eat the fish that might be contaminated. So these are the type of risks that we can see. Natural disasters, plenty. This is from this week, 2 days ago, or 3 days ago. 400,000 people had to get out. These are all consequences of climate change. And of course, as we speak about this here, a technological type of meeting, the United Nations, they're saying it doesn't exist. So these are troubling times. But these are reality. The causes might be different, but that it's happening is unquestionable. This happened in Valencia in November. This happened in 22 in Pakistan. Now, the reason I bring this up is because Pakistan is the third producer of agriculture in Asia. And look what happened in 25. This is this year, August 20. The worst flood ever.
Where
Where are they gonna get the food? The people are probably gonna move. Again, issues of migration. Countries with flood risk, these are all floods in 23, but I've been following that. Of course, you have fires and droughts. Affecting a lot of countries. This is all in the Horn of Africa. But also in the US, more and more people have been moving to Vegas. And they want to have a nice green in their homes. With that population explosion, more and more water has been consumed from Hoover dams, which means that water, that critical infrastructure was important to produce hydroelectric power, but also to produce the water that is being drank. And states like California use it for agriculture. So we have this lake, the Great Lake, Salt Lake. It has 3 rivers that put a lot of arsenic sediment. Now, if the lake used to be all around that orange line, if it would disappear, people would stop living in Salt Lake City because arsenic produces cancer, and that sediment will start flying because there's no water to hold it. So those are consequences. The other problem is that as people start pumping water from downstairs, there's this effect called subsidence, which dislodges the arsenic from the rock and then contaminates that contaminates the agriculture. So more people are gonna be the natural disasters that happen in the northern part of Africa and Turkey generated, and the floods in Libya generated about 720,000 migrants. And of course, the more migrants that we have, the less information sharing, war hazards, same thing, lots of people moving to other countries. And the problem is that it's not just the guns that Ukraine and to fight the Russians, but the destruction that is happening and the people separated. But the fact is that 52 countries, if they don't receive the grain or that from that Ukrainian Russian region, they're going into panic. People don't pay attention. That was what that graph was. When these people go to other countries, Poland, Hungary, wherever they go, it's a different language. They don't have medical records. Of course, we have all this knowledge, which I label as geomedicine, which involves neighborhoods, our houses, the things in your house, services, the drinking water, the air you breathe. And this was the EPA Air Quality Index. Anything above 100 is considered unhealthy for people with asthma, for example. But if you reach 300 to 500, it's hazardous. You should stay home. Well, in November 4th of last year, in Lahore, in Pakistan, they measured 1,900. Never in the history of our country. And in Delhi, many places, they measured 900 multiple times. That whole area of Delhi and Lahore is at least 40 million people. So these are incredible problems that will make people migrate. And so what I'm suggesting is creating some sort of a medical record that contains all this information, that it would be like a little card that we could provide within IEEE. I'm trying to convince IEEE to do this. With the backing of the United Nations, UNESCO, whoever, the WHO, so that poor people can have, but also us. If we go to Paris and we get sick, we would have a card that has our basic history, vaccines, allergies. And we could react, we could be preventive and improve the qualities of life. And by the way, these are this is my last slide. Global environmental disasters. Look at the temperatures in number 7, exceeding 55 degrees centigrade. That's 131 Fahrenheit. In Saudi Arabia, Iraq, and Iran. Of course, locust invasion in Kenya, Ethiopia, Somalia, the Colorado River that I showed you. So what happens in the information age when 60% of the world humanity is not connected? What about clean water, food, and energy that are essential to survive? Forced displacement stems from a wide spectrum of drivers to wars, geopolitical conflicts, terrorism, natural and human-made disasters, political or religious persecution, ethnic or sexual orientation discrimination, lack of economic opportunity, and accelerating climate change. So that involves floods, droughts, rising temperatures and sea levels, and extreme winds. Migrants and refugees face additional challenges associated with the digital transformation. If you go to the Computer Society of IEEE, they're going to be talking about the metaverse, AI, and the digital transformation. Because everything now we do it digitally. Well, these people, they don't have education. You can imagine how necessary it is in order to have. And the last point there, having affordable card containing their family, personal history, vaccines, medications, information on where they live. And the reason I say that is because I'm getting older. I'm starting to have one condition that I never had. Do you smoke? I always say no. But nobody asked me, where did I live or where do I live? When I went to school at UCLA, living in Los Angeles was equivalent to not 50 years a day. So that becomes very important for prevention purposes. Because I did not smoke, but my lungs did. All right. So I'm concluding.
Thanks.